Try to keep this brief. We're going to spend the next 15 or 20 minutes today talking again about the return of school. It's on everybody's mind, and we're going to spend some time today talking particularly about contact tracing and contact investigation when somebody tests positive in a school, which we know will happen. As a reminder, this week I'm having press conferences every single day at 1 o'clock, all primarily focused on school and getting the kids back to school. As always, we start off with the data, and as you can see in front of you, we continue to trend in the right direction, which is a great thing. We've been working very hard over the past month to make sure that we were in good shape as a state to reopen the schools for kids, and data today suggests that we are. Yesterday, we performed over 4,000 tests. We saw a percent positive of 1.3%, among the lowest in America, and we saw only 53 new cases, even though we tested over 4,000 people. Very sadly, another death. Every day we continue to lose people, so please bear that in mind. This is a very serious virus, and continue to follow the rules, because even one lost Rhode Islander is too many. As a recap, earlier this week, we gave the green light to every school district in the state of Rhode Island, except Providence and Central Falls, to begin with full in-person, in-school learning for all children starting September 14th. So that is, I hope that that is clear. I also want to reiterate, every parent still has a choice. We're still getting a lot of calls, so I'm going to try to clear this up. Just because your school district has the green light and the authority and the ability to reopen school in person and is providing in-person education for all children, it doesn't mean we're forcing you to send your kids in person. If you, as a parent, feel that it is better for your child to do virtual learning at home, no one is going to force you to send that child to school. We understand that there are reasons that you may want to do that, and that is your prerogative. However, it is the obligation of the state and each city and town to provide a high-quality in-person education for the children of Rhode Island. And so we have said, starting September 14th, every district except Providence and Central Falls has been green-lit to start with full in-person learning. No parent is forced to take that option. We expect that full in-person learning will require some bit of a ramp-up. We don't expect any school to, on day one, September 14th, to welcome every kid back every day for a full day. The ramp-up period will happen between September 14th and October 13th. But even on October 13th, if you have chosen as a parent to do virtual learning, you can go ahead and do that. I hope that's clear. I said it yesterday. I'll continue to say it. If you have any questions, let us know. Okay. Yesterday, I talked about our comprehensive approach to testing for public schools, and today I want to talk about what happens when a child, a student, employee of a school, a teacher, tests positive, which we know will happen. What happens next is the process that we have been referring to as contact tracing. Now, of course, a few months ago, none of us had ever heard of contact tracing, except for the experts in the Department of Health. It wasn't something that the rest of us had really become familiar with. Today, of course, we are. We've spent the past 6 months here in Rhode Island developing an incredibly robust and effective system of contact tracing and also case investigation. Case investigation, sometimes we say CI, case investigation, is when the Department of Health and the team works with somebody who's tested positive to help them remember everybody they've been in close contact with since the time that they have become infectious. So contact tracing begins when we start reaching out to those individuals so that we can safely get them and all their contacts to quarantine. That's why I've been up here for months asking you, please, to keep your contact tracing notebooks. And if you haven't had a chance to do that yet, now's a great time to begin, especially if you're a parent with children going to school. Go get a contact tracing notebook for your kids. It's pretty simple. Every day, have them write down who they were in close contact with. It is simple, but it will absolutely save lives, because you will get a phone call. If you test positive, if your child tests positive, you're going to get a phone call from somebody at the Department of Health, and they're going to take you through an interview and ask you who you've been in contact with. Now, just like we're doing with testing, which I explained yesterday, we're establishing a dedicated, separate K-12 contact tracing system for students and staff at both public and private schools. We're beginning by dedicating 50 members of our team exclusively to K-12 contact tracing. And if 50 is not enough, we'll add more. But based on, we've been doing this for 6 months, we have a model, it's the Department of Health, the National Guard, we've hired others. We feel pretty confident 50 is the right number to begin with. If it's not enough, we'll add more. So bear with me for a couple of minutes, please. Parents, teachers, students, I'd like to explain how it will work so you're not surprised by it. If you're a student or you work in a school and you test positive for COVID, you will, as I said, get a call from the Department of Health, a case investigator. They'll ask you a series of questions about where you've been and who you've been with in the past 2 weeks. That includes inside and outside of school. That's, again, why it would be great if you had your contact tracing notebook. Maybe you went out for dinner with friends. Maybe you played a sport with somebody. Maybe you went to the grocery store and you've been in school. So it's an interview, it's pretty extensive, and they'll ask you a series of questions. Why do we do this? Because we want to immediately, or as quickly as possible, identify anyone you've been exposed to get them into quarantine. Now, we know students, just like all of us, aren't going to remember exactly who they've been near. So in addition to that phone call, when you're interviewed, the case investigators will connect directly with your school. Every single school has designated at least one staff member to assist the Department of Health with case investigations. And when we see a case associated with a school, our case investigator will reach out to the staff member to get information with the goal of determining who was a close contact. Now, if you're wondering, as a lot of people have been asking, what is a close contact? A close contact is anyone that you have been close to, within 6 feet, for more than 15 minutes at a time. So it's not someone you were with for a minute, it's not someone you casually brushed by, it's not someone who you chit-chatted with briefly. Close contact for 15 minutes or more. When the Department of Health calls that person at the school, they'll ask questions like, how does the student get to school? So we know whom they may have been with on the bus. What's their assigned seating on the bus? Who's near them on the bus? When was that individual last in school? Who sits next to them in class? Who sits next to them at lunch? Et cetera, et cetera. Now, this is the reason why, for the past couple of months, we've been saying to everybody, school this year has to be incredibly structured. This is exactly why, incredibly structured. So seating charts are vital. Seating charts on the bus, seating charts at lunch, seating charts in every single classroom. Because when somebody tests positive, the case investigator will call the person and the school representative and they're going to want to have a good handle of who's been around that child, who sits near that child at lunch, who sits near that child in the classroom, who sits near that child on the bus, etc. Close contacts of a person who've tested positive have to quarantine for 14 days. And if you're a student, that means you'll be doing distance learning at home for those 14 days. During that time, they'll be monitored for symptoms, and of course, they'll be tested. But I want to be clear, even if you test negative, and even if you don't ever develop symptoms, you still have to stay in the full 14-day quarantine. Okay, now that's for close contacts. But what about classmates? A question that we hear pretty frequently is, what if my child is in a classroom or a class with somebody who tests positive? And the same from teachers. If a student in my class tests positive, do I need to quarantine? Does my child need to quarantine? And the answer is no, you do not, unless you meet the definition of being a close contact, and you will be told that by the investigator from the Department of Health. So, and again, that means if you were close to somebody for more than 15 minutes. So if you send your child to school, you hear from your child that somebody in his or her classroom tested positive, that doesn't necessarily mean that your child has to be in quarantine. It's only if your child was a close contact with the person who tested positive. Having said that, if you feel more comfortable, go ahead and get your child tested. That is fine. We have ample opportunity to do that. But we don't want parents to think that your child has to automatically be quarantined just because they were at lunch with or in a classroom with somebody who tested positive. And the same is true for a teacher. Every single school has set up processes for communicating with students and families when there is a positive case in a school. We know that because that was what had to happen before the Department of Health signed off on the district's plan. The Department of Health will be there supporting our school communities each step of the way. And we know we're going to see positive cases. By the way, we're seeing positive cases now among children. They've been in child care all summer. They've been at been in sports all summer. They've been having summer jobs at the grocery store. We've been seeing positive cases all summer, and we will see cases when school opens. The focus, so we can't stop that. We can't stop the positive cases. What we can do is quickly identify the positive cases, put our systems into action, do our contact tracing, quarantine all the close contacts to prevent outbreaks and to allow for a smooth operation of school, as smooth as is possible considering the circumstance. Just like we've been doing for 4 months with child care and churches and the prison system and congregate care and nursing homes, we've gotten pretty good at dealing with these incidents and preventing outbreaks. Rapid, effective contact tracing will allow us to minimize disruption and keep kids, students, teachers, and all school employees safely in school. Now, I want to be clear. We've said from day one, we're not going to allow people to be in school if we don't think it's safe, if we don't think the risk is low enough. So we have a comprehensive system and set of standards for when we might need to actually scale back in-person learning. And that's based on our testing and contact tracing. And please put the slide up. The slide in front of you is one that I showed a couple of weeks ago, but I just wanted to put it out briefly again to reassure everybody that we have a plan. We have a very thoughtful plan for when we might have to shut down a classroom, temporary shut down an entire school. If you look at the slide in front of you, in the first scenario, limited cases within a stable group is exactly what I just talked about. We would immediately test, do contact tracing, and quarantine anyone in close contact with a positive case and continue operating in that classroom and in that school with limited disruption. In the second scenario, where we would see cases in multiple groups, but where there's a clear link within a school, we would take the same exact steps. Rapid testing, rapid contact tracing, quarantining, school continues with minimal disruption. In the third scenario, where there's community transmission impacting multiple groups without a clear single link in the school, the Department of Health at that point might also consider a more aggressive step, such as temporarily closing a school or a section of a school. As a reminder, if you are interested in even more detail, if you go to the website Back to School RI, there's a very detailed 24-page health protocol playbook that goes through step-by-step everything that I've just reviewed in summary. So, bottom line is this. We have a separate system and hotline for K through 12 testing, separate system for K through 12 contact tracing and case investigation. We know there'll be positive cases. We're fully prepared to deal with them. If there are a limited number of positive cases, we do rapid testing, rapid contact tracing, quarantine and isolation. School goes on as normal with limited disruption. If, however, the Department of Health, working very closely day by day with the school, finds that there's a broader transmission, then they will at that time make a decision to close a classroom, close a section of a school, or close the school. But that will not happen for just isolated positive cases in any particular school.